Gouet & Associates happily presents Healthcare 101. CNA knows healthcare insurance is a trending topic these days. We are constantly thinking about our health. Health insurance is a necessity just like food and shelter. Incorporating health costs into our monthly budget is best practice. I know what you're thinking. Insurance terms are hard to understand, and most terms have a financial dynamic to consider. Where do I start? Let's take a quick crash course on healthcare and carefully review health insurance terms to make purchasing a healthcare plan easier for you and your family. Benefit is the care you need. A doctor's office, X-ray and labs, and even a hospital stay are all listed benefits on your health insurance policy. Premium is your monthly payment. If you have an individual policy, this will automatically get withdrawn from your bank. If you have insurance benefits through your employer, the premium is deducted from your paycheck, usually on a bi-weekly basis. The premium is paid to the health insurance carrier. Examples of carriers are Aetna, Oscar, Ambetter, and Blue Cross Blue Shield. Copay is a set amount paid to doctors, facilities, or pharmacies at the time of service. If a benefit has a copay, usually a deductible does not apply. Copays can range from $5 to $200 depending on the benefit. The deductible is the amount you pay before the insurance carrier helps you pay for the cost of your healthcare bill. Some benefits do not require a deductible while others do. It is important to study your summary of benefits so you can become familiar with what benefits require a deductible. The deductible amount varies according to the plan. Coinsurance is the cost share between the health insurance carrier and yourself. Health insurance carriers start splitting the cost with you once the deductible is met. Some plans have a cost share of 80-20, which means the carrier pays 80% of the bill and you only have to pay 20% of the bill. The coinsurance percentage varies. It could be 80-20 on one plan, and in others it can be split between 90-10, 70-30, 60-40, or even 50-50. Maximum out-of-pocket is the most you pay for the plan year. Deductibles, copays, and coinsurance can all apply to your max out-of-pocket, depending on your plan. Once you meet the max out-of-pocket amount for the plan year, your health insurance carrier pays 100% of the healthcare bill. Let's not forget about our providers. There are PCPs, which stands for primary care physicians, and specialists. PCPs is the first contact and is the continuous contact for a person's health. Primary care includes preventative health, patient education, and treatment of acute or chronic illness. Specialists concentrate on a certain condition or anatomy in your body. For example, those who seek care for heart conditions see a cardiologist, cancer patients work with oncologists, and diabetics can see an endocrinologist for glucose guidance. Let's look at a medical example and apply these terms. First things first, always look at the summary of benefits for your healthcare plan before going to a doctor. The summary of benefits help you have an idea of what you will pay for the benefit. Deductibles, coinsurance, and copays are listed on the summary of benefits. Here's a timeline with an individual deductible of $1,500 and an individual max out-of-pocket amount of $2,500. Danny visited an in-network PCP for his preventative wellness checkup. He did not have to pay towards a deductible or copay at the time of visit since it was a preventative visit. Danny received a call back from his PCP. The PCP requested a follow-up visit to discuss his results. The summary of benefits lists a PCP visit office has a copay of $15. The copay applies since the visit is no longer preventative. The visit is not preventative because they will be discussing a diagnosis. The PCP requests for Danny to see a specialist. Danny explains to the specialist, a gastrologist, how he has pain in his stomach and his test results from his healthcare visit show something is wrong internally. So recap, the PCP copay was $15 and the specialist copay was $55. Copays apply to the max out-of-pocket bucket. Let's continue. The specialist needs more information, so he orders for Danny to take an MRI. MRIs usually fall under major diagnostic benefits, and for Danny's plan, the deductible applies. Once the deductible is met, he only pays 10% of the cost. In Texas, an MRI can cost thousands of dollars. For Danny, his in-network rate is $700. The MRI shows poor results, so Danny unfortunately needs surgery. Surgery can be tricky because surgery costs apply for what seems like one service. The surgeon gets paid, facility fees apply, the surgery itself comes at a cost, and additional costs can apply like surgery equipment, and assisting surgeons may also request a fee. For Danny's surgery, the total cost is $3,000. Let's add up the costs and revisit Danny's financial buckets. The MRI applied to the deductible, so we subtract that cost from the $1,500. After the MRI, Danny has $800 more to spend before the coinsurance. Shared costs can kick in. Notice the MRI also applied to the max out-of-pocket. Danny is now sitting at $800 left to meet his deductible and $1,730 to meet his max out-of-pocket. As a reminder, the copay, deductible, and coinsurance amounts are paid to the doctors who are helping Danny with his health care. Now let's apply the surgery cost. The surgery also applies to the deductible. Danny only has $800 left to pay, so the surgery partially applies. Danny pays the $800, and just like that, Danny has made his deductible. His coinsurance kicks in, so the carrier will now help him pay for the surgery. Subtracting the $800 that was applied onto the deductible from the total cost of the surgery, $3,000, the total amount left is $2,200. Danny's coinsurance benefit is set at 90/10, which means Danny only has to pay 10% of the remaining bill, and the carrier will pay 90%. Instead of paying $3,000 for the surgery, Danny only paid $1,020. He paid $800 towards the deductible and then only $220 to meet the coinsurance cost, which adds up to the $1,020. And notice the max out-of-pocket is now sitting at $710. Danny needs medication to help him recover quickly from his surgery and healthcare condition. Medication is also part of your healthcare benefits. Checking to see if your pharmacy is part of the healthcare network is just as important as looking for an in-network doctor for cost savings. When a doctor prescribes you medication, don't be afraid to ask, is this medication in my healthcare formulary? There are millions of medications out there, and a lot of them do the same thing. Your doctor should always try to find a medicine that works for you medically and financially. Looks like the benefit for this medication is a $20 copay. In just a couple of months, Danny met his deductible and is close to meeting his max out-of-pocket amount for the year. That was a lot of information. Let's review the insurance terminology. Premium is what you pay monthly to the carrier. Deductibles have a bucket to fill up, and max out-of-pocket is a separate bucket to fill up. The max out-of-pocket is different because deductibles, copays, and coinsurance can apply. Coinsurance is a shared cost, so you only pay a percentage of the healthcare bill, and copays are a set amount paid at the time of service. Summary of benefits are important too because this document helps you visualize what you have to pay for your benefit. Using an out-of-network provider increases the cost you pay, so remember to use an in-network provider for cost saving. I hope this crash course cleared up some health information questions for you. Have specific questions on this example or applying your benefits? Call me. I'm Jenna Flores, Individual Health Sales Manager for Guerra & Associates, 210-640-2433. CNA is working for your tomorrow today.